about safe sleep and safe sleep education as it pertains to our patient population and how we can educate our patients and perform safe sleep audits. Some of the objectives are going to be explaining why safe sleep is important, defining what the ABCs of safe sleep are, recognize when unsafe sleep is occurring, demonstrate teaching family members about safe sleep, and performing a safe sleep audit. So let's start with why safe sleep. Sudden and unexpected infant death, SUID, which includes sudden infant death syndrome, SIDS, is the leading cause of injury, death in infancy. And this is according to the American Academy of Pediatrics. Rates of safe sleep-related infant deaths fell drastically after AAP recommended infants should be placed on their backs to sleep in the 1990s. Fall prevention of infants in the hospital is done by performing safe sleep and advocating safe sleep with our patient population. If you look at the graph in the right-hand corner, you can see what is the cause of death in 2022 for SUID, and this is based on international data. And a lot of those things have to do with accidental suffocation and strangulation in bed, which is something that we can prevent if we're adequately educating our patients. So the ABCs of safe sleep. Safe sleep is alone, back, and crib, that ABC. Place baby alone in crib to sleep on their back, so babies are always on their back, and in the crib, so using a firm flat mattress and a fitted sheet, keeping that crib empty. And when we say crib, it can be crib or bassinet. A lot of our patients will utilize a pack and play at home. That's totally fine. The most important is that they're not utilizing a car seat or a swing for sleep. So let's kind of delve into these a little bit more. So A is alone. Infant should be in a bassinet, not sleeping with parent or family member, no extra blankets. A sleep sack on the infant or a blanket that is being used for swaddling is okay. No pillows, no stuffed animals, a pacifier in the bassinet is okay. And when we're talking about the hospital, if the infant's greater than 24 hours old, there should be no hat on the infant. If there have been temperature issues with the baby, then that's okay. But at this point, 24 hours old, they shouldn't have a hat on. You'll see here an example: safe sleep, unsafe sleep. B, back. Infants should be on their back. They should not be placed to sleep on their stomach. They also shouldn't be placed to sleep on their side. The head of the bed should also be flat. If the head of the bed is at an angle, we need to ask why. And this needs to have an order. If there is a reason why the head of the bed is elevated, there needs to be an order for that head of bed to be elevated for reflux purposes, but that is not the standard, and we should not be educating our patients to do that. Again, if you find a head of the bed elevated, it is a reason to go back to the nurse and ask, why are we doing this? Again, safe sleep, not safe sleep. Crib. Infant should be in a crib or in a bassinet. We don't use car seats for sleeping. We don't use swings or bouncers for sleeping. When we discuss, one of the admission questions that the nurse should be going over is, do you have a bassinet or a crib at home? If that has not already been an identified issue, that is something that we can get involved with and get a social work consult for them to ensure that there is a safe place for baby to sleep at home. Common question: what if the parent or the family member is holding a sleeping infant? So if the patient or the family member is awake, it's okay. Somebody can hold a sleeping baby, that's okay. But if the patient or family member is, or the parent or the family member is asleep, it's not okay. We need to intervene in that situation. So let's talk about two situations that could very well happen on the unit. So you walk into a patient's room at 0400 for vital signs following a vaginal delivery at 2200. The patient is asleep in bed with the infant on her chest. And this is an example of that type of unsafe sleeping situation. So what are we going to do in that situation? We're going to gently secure the infant by taking it off the patient's chest and placing them in the bassinet, ABC. Try to do that gently and not wake up, and most likely the patient is going to wake up during that time. but we don't want to we don't want to jolt the patient awake. That's going to increase the risk for dropping that infant. So we're going to politely and calmly wake up the patient and get the infant off of the chest. Those things might happen simultaneously, but in that moment, the quickest thing is to make sure that we get that baby to a safe position. After we make sure that the infant is safe and the patient is awake and able to understand any sort of education, because remember it's 4 in the morning, we are going to educate the patient on safe sleep. We're going to review the ABCs. We're going to talk about how if we don't follow that, we're increasing the risk for dropping that baby. The other thing is discussing a sleep plan at home for the infant. We need to make sure that this isn't going to happen at home. Do we have a safe place for baby to sleep? Again, that crib bassinet conversation. And then also discussing support system availability. This mom is tired. She just had a baby. Is there going to be resources available for her at home to be able to get the sleep that she needs without feeling like she needs to co-sleep? And then reporting to the nurse about what happened and any outcomes. Education is obviously something that needs to happen under RN, that is under like the RN scope of practice. But we do need to educate in the moment. And so you can educate the patients, and then you need to just report to the nurse that that education has taken place and that you have intervened. And most likely there will need to be some sort of documentation on that needs to be followed up with. So situation number 2, you enter a patient's room at 12:30 to get an infant for 24-hour testing. The infant is wrapped in a sleep sack with a hat on in the bassinet with a fluffy blanket underneath and over the sleep sack. There's also a stuffed rabbit in the bassinet that was gifted by the grandmother. And here's an example of what that would look like. So what do we need to do in this situation? We need to explain to the patient that this is not safe sleep. Remove the stuffed rabbit, extra blankets, and hat from the infant. And again, you don't just start removing things, you explain to the patient exactly why it's not safe sleep and why you're taking those things out before you just remove them. Educate the patient on safe sleep. Review the ABCs. Discuss the sleep plan for the infant, and again discuss support system availability. And once again, we're going to report to the nurse what's happened and the outcomes. More than anything, just ensuring that these patients are going to be safe when they go home. And the more that we reinforce what safe sleep is in the hospital and demonstrate that for them, the more likely that they're going to fall within those guidelines when they get home. So one of the reasons we are discussing the safe sleep is because we are going to be performing safe sleep audits as a goal. So what is basically covered in those audits are the ABCs of safe sleep, that the head of the bed is flat, and that there's no hat on the infant after 24 hours of life. I'm going to go ahead and walk you through how to conduct a safe sleep audit, and it's through the Power Apps on your phone. So the same place where you go to do hand hygiene audits is where we're going to go to do those safe sleep audits. So obviously this is where it lives on my phone, but you're going to go to this Power Apps right here. And if you don't have this downloaded, this is what it looks like. You're going to go ahead and download, and you'll have to log in. If this is your first time ever using Power Apps, you will log in using your IU health information. And this is something that is being encrypted, that you'll have to set a passcode, but you can also bypass it by using your Face ID. Once we open that app and it confirms you are who you say you are through the IU health system, it's going to give you, it will open up with a home screen of like what your favorite apps are. At the bottom here, you can kind of see through here, there's an all apps, and you will click that and it will come up with this. And initially it'll be a very long list of all the different Power Apps. You're going to put bundles in this search bar, and you're going to do bundles and audits Riley. And if you click on that, you can either use these 3 dots to go ahead and add it to your favorites, or you can just click on it so that you can get into the bundles and audits. Your first time doing this, it's going to ask for your permission to use this, and you're going to say allow. So now you're going to get this screen. So this is another way to perform hand hygiene audits, but there's a different app to be utilized for that. So we're going to do new bundle audit. That's what we're going to click on once we get to this. this is what's going to pull up here. So you're going to want to change the hospital to IU Health Fishers Hospital, and then observation unit Fishers LDRP. There's also a Fishers Special Care Nursery if we are performing safe sleep audits in that realm. ARI is performing safe sleep audits for special care. I think primarily our focus is on LDRP, but you can also do them for special care. It makes you put a room number in, and then it's going to make you answer these questions. Is the patient wearing an armband? And are there any additional ID bands in the room not on the patient? This should never happen. We should never have additional armbands. We should only ever have the ones that are on the baby, which is on the left wrist and the left ankle. Then you're going to click Safe Sleep Audit. This is what's going to pull up for you. So non-NICU, that's going to be your LDRP rooms that you're going to do. And then you're just going to answer these questions, you know, and again, we're going to go through the ABCs. Is the baby dressed? Is the bed empty, which is basically the same as alone? Head of bed flat, and has the infant's hat been removed? If it's less than 24 hours, that hat can still be on the baby. If the baby's having temperature issues, hat can still be on the baby. But if neither of those quality criteria are being met, if they're greater than 24 hours not having temperature issues, then the infant should not be wearing a hat. This also can change to NICU, which would be our special care setting. When you hit next after you answer those questions, it's going to basically say elaborate on these things. If you answered yes to any of these questions, then what was wrong? And kind of exactly, you know, the baby had a soft blanket in there. There was a rabbit, a stuffed rabbit. And then what did we do to correct that? So kind of what's going on and what did we do, and so we removed the stuffed rabbit and we educated the patient that the baby needs to be alone in the bassinet, and follow up with nurse. And then you're going to hit submit. And that is fully how to do an audit, a review, an audit. And I know that that's a goal going forward for this year. So in review, safe sleep is ultimately to prevent infant falls and prevent those sleep-related injuries and deaths to our babies. We went over the ABCs of safe sleep, so alone, back, and crib. No hat on the infant over 24 hours of life. Ensure there's a home plan for safe sleep, and that is utilizing social work if necessary, and that's just a conversation with the nurse so that we can get that consultation put in. And then communicate all concerns with the nurse and the MD as far as if unsafe sleep continues to be an issue, that is something that needs to be documented on, and once again needs to be followed up with social work to ensure that that baby is going to be safe at home. If you have any questions or concerns, please let myself or Jenny know, and we would love to answer those questions and help out with any documentation needs as we roll out this safe sleep audit and safe sleep process for you guys. Thank you so much.